Greetings to Dr. Sidia. We are from Group 10 and this is my group member name and the metric number. Today we will present our case study that we get from Medical Tree and it is about a 79 years old lady with myasthenia gravis. So this is outline of our presentation. So this is patient by data. The patient is Madam G and she is 79 years old Chinese lady. She is a Buddhist and her current medical diagnosis is myasthenia gravis with goiter. For the chief complaint, before being admitted to the hospital, she complained to her doctor that she cannot swallow solid food and was only to take soft food and water. She also complained she has a lot of secretion and sometimes causes difficulty for her to eat. She also said that she had a difficulty to swallow food. For the reason of admission, she was admitted to Sarawak General Hospital on 11th of January 2021 due to difficulty in swallowing. Prior to the admission, she was accompanied by her family members. When performing general inspection during the admission, she was found to have a drooling saliva and ptosis at both eyes. Other than that, when talking to her, she talked in slurred speech. Her current diagnosis is myasthenia gravis with goiter. Next, for the social history, she is married and have two children, which is one daughter and one son. She lives in Jalan Setakan but currently staying with her granddaughter at Butong. She was an active smoker before this but stopped 3 months ago due to difficulty in breathing. She started to smoke when she is 15 years old and took one pack of cigarettes per day. She denies she is an alcohol drinker and drug user. For medical history, she was admitted to hospital on 30th of October 2020 until 5th of November 2020 due to fluid overload. And on 2nd of January 2021, she was admitted to PJ House due to shortness of breath. She was diagnosed with type 2 diabetes mellitus 2 years ago and hypertension since 10 years ago. She was also diagnosed with chronic bronchitis and emphysema (COAD) and had a history of admission at Hospital Betong due to COAD. She had a hearing impairment at 11 years since 3 years ago, and she claimed that she was compliant with all of medication. For the surgical history, she has no none of surgical history. Next, I will pass it to my friend.
Thank you for passing the section. Now I'm going to explain other part of pathological changes due to the disease and or aging process, its clinical manifestation, as well as the age-related changes. Our patient's case is myasthenia gravis. It is a chronic autoimmune neuromuscular disease that involves the immune and muscular system of a human. It can affect people of any age, and it is more common in women younger than 40 and in men older than 60 years old. In normal humans' neuromuscular junctions, acetylcholine that function as the neurotransmitter will be released from the motor nerve terminal, diffuse across the synaptic cleft and bind to the receptor on the folded muscle and plate membrane. The binded acetylcholine quanta depolarize the muscle and plate region and followed by the muscle membrane, thus causing muscle contraction. However, in myasthenia gravis, the postsynaptic muscle membrane is distorted and simplified by the immunopathological mechanism. Immune system of the body forms antibody that block or attack acetylcholine receptor that located on the muscle cell surface. Acetylcholine is still released normally, however, due to the decreased concentration of the acetylcholine receptor on the muscle and plate membrane, its effect on the postsynaptic membrane is reduced. This results in the muscle weakness as muscle receive fewer nerve signal with fewer receptor sites available. Antibodies also block the function of the muscle-specific receptor tyrosine kinase, thus impair the signal transmission at the neuromuscular junction. This disease results in the weakness of the skeletal muscle that worsen after the period of activity and improves after periods of rest. It primarily affects the muscle of the face, neck, throat, and limbs. It may be associated with the thyroid gland located in the neck as thyroid gland enlarged when attacked by the immune system, resulting in swelling, which is goiter. People with myasthenia gravis may present the following clinical symptoms that involve eye, face, throat, neck, and limb muscles. There is weakness of the eye muscle, drooping of one of both eyelids, blur or double vision, change in facial expression, difficulty swallowing, impaired speech, and weakness of the limb or neck. In our case, patient was present with the symptom of difficulty swallowing, ptosis, slurred speech, and drooling saliva, which was similar to the symptoms of the current medical diagnosis of the myasthenia gravis. Age-related changes at different body systems among the elderly have resulted in the functional changes that bring different impacts on the elderly's health, and it also increased the difficulty in correctly diagnosing the myasthenia gravis among the elderly. Across the age, the immune system loses efficiency and experience widespread of dysfunction, resulting in reduction of immune response and production of autoantibodies. The hearing ability among the elderly decreases eventually due to the changes in the inner ear and auditory nerve. It may make it hard for an elderly to tolerate loud sound or to hear what others are saying. Our patients have experienced hearing impairment since 3 years ago, and aging had caused a decrease in the total eyelid area with sagging of the lower eyelids. That's more difficult to diagnose autopsies in the elderly. Diplopia or double visions among the elderly may not be detected because of the reduced vision due to the macular degeneration or cataract formation. Now I will leave the following sections to my fellow groupmates.
Thank you. So next, I'm going to present on the aging theory related to Madam G's case. We are using immunosenescence theories because Madam G is having myasthenia gravis, which is an autoimmune disease. Immunosenescence theories talks about the age-related declines of the immune systems that increase the susceptibility of the elderly to diseases such as cancers and infections. Also, the immune systems may even attack the healthy cells in the body, leading to autoimmune disease like what Madam G is having now, the myasthenia gravis or rheumatoid arthritis. Next, I'm going to let Fahmi to present on the part of assessment.
Thank you, Josephine. Next, I will talk about physical assessment. During the assessment, patient was calm, alert, and comfortable. As for general appearance, her head was clean, no dandruff, and no head lice. Her eyes, nose, and ears was clean and no discharge. Her conjunctiva was pink. There is no cyanosis and no dental caries in her mouth. Her lips were pink and moist. There is a knot felt at the right side of thyroid limb cartilage level in her neck. Her skin was intact, sugar, and warm to touch. There is no skin rashes and redness seen. Her chest expansion is symmetry and her chest wall is intact with no tenderness. On her breast, it is soft, no lump detected, and both nipples was erect with no discharge. On her abdomen part, it is soft, no tenderness, and no abdominal distension. On her upper extremities, there is no scars and lesions noted on both extremities. There is no tremors on both hands. All her nails were pink and capillary refill was less than 2 seconds. On her lower extremities, there is no edema noted on both legs. There is no varicose veins detected. Last, on her genital area, it was clean and no discharge. This is Madam G's vital sign. Her temperature was 36.2 degrees Celsius. Her blood pressure was 126/66 millimeter per mercury. Her pulse rate was 73 beats per minute. Respiration rate was 21 breaths per minute. Oxygen saturation was 100% under room air, and her pain score was 0 out of 10. Next, functional assessment performed is CATS Index of Independence in Activities of Daily Living. It consists of 6 activities. So the first, bathing. She need help with bathing more than one part of the body, getting in or out of the tub or shower. In the dressing, she was able to get clothes from closets and drawer and put on clothes and outer garments complete with fasteners. Toileting, she required help transferring to the toilet, cleaning herself. Transferring, she also needs help in moving from bed to chair and requires a complete transfer. Continence, she was able to exercise complete self-control over urination and defecation. Feeding, she was able to get food from the plate into the mouth without help. Hence, Madam G scored 3/6. which indicates moderate disability requiring supervision and personal assistance from relative members. Second functional assessment is modified Bartle index. It consists of 10 activities. So first, she required minimal help for feeding and grooming. However, she was able to control bowel and bladder, which means it is continent. She also required minimal help for dressing. Besides, she required moderate help in transferring, toileting, walking, stairs, and bathing. Hence, Madam G scored 69 over 100, which indicates moderate dependency level with 20 hours of help required per week. The third functional assessment is most fall scale. It consists of 6 items. So the first, Madam G does not have history of falling within 3 months. She has been diagnosed with myasthenia gravis with goiter, with medical history of type 2 diabetes mellitus and hypertension. She is able to ambulate by herself but slowly. She is not on any intravenous fluid. She has little difficulty as her gait was unsteady and weak. She is oriented to own ability. Hence, Madam G scored 25, which indicates moderate risk of fall. Next, we move to the psychosocial assessments. The first psychosocial assessment performed is Mini Mental State Examination, MMSE. On the orientation part, Madam G has a good orientation towards her surrounding as she was able to mention date, place, town, and country, which she scoring a full mark. On the registration part, Madam G was able to repeat 3 words given, which are apple, umbrella, and pen clearly. On the attention and calculation part, she was able to perform serial 7 starting from number 100 subtracted with number 7 until until the answer 65. After that, we asked Madam G to recall 3 words given just now, and she was able to recall all the 3 words clearly. On the language part, she was able to recognize given items which are watch and pencil. She was also able to follow 3-stage command and draw pentagons. However, she was not able to do repetition 40 for stone lion in Chinese. She could not read and follow words written. Close eyes, raise your hands. Besides, she was also not able to write a meaningful sentence as she could not write. The total score by Madam G is 27 over 30, indicating a normal mental status. Second, Genetic depression scale, which consists of 30 questions. After asking all the questions, we found out that she answered 9 questions wrongly. She stated that she felt hopeful about the future, afraid that something bad is going to happen to her, and preferred to stay at home. She felt that she is having more problems with memory than most, felt pretty worthless, think that most people are better off than herself, prefer to avoid social gatherings, failed to make decisions, and she did not have clear mind as she used to be. However, the result is normal, indicating that she did not have depression at the moment. The third psychosocial assessment is geriatric clock test. Instructions: I would like you to draw a clock, put in all the numbers, and set the hands for 6 after 10 were given. As we observed Madam G perform this geodetic clock test, Madam G was able to draw a circle represent the clock face. Madam G was able to put all numbers starting from 12 until 11. However, the number 11 was not aligned with the circle and next to the number 10 as, as it is on this picture. Madam G was able to draw a dot in the center of circle. Madam G was able to draw short hand pointing to the 6 but long hand pointing to the 10 as it should be pointing to the it should be the long hand pointing to the number 2. Hence, Madam G scored 8/10, indicating the patient must be interpreted clinically. Next, I will pass to Elida Mariani.
Thank you for me for presenting the assessment part. Next, I'm going to present on the diagnosis test done on Madam G during her hospitalization. During her second day of admission, as she has been suspected of having myasthenia gravis since her first day of admission, so she was ordered to do an ice pack test on the next day. After placing a few minutes of ice pack on her drooping eyelids, the result shows that her eyelids has improved more than 2 millimeters after the ice pack has been removed. So this is a positive result suggesting that she is having myasthenia gravis. Also, there are also some blood investigations have been done on Madam G. However, every result of the blood test includes FBC, hemoglobin, red blood cells, red cells, lymphocytes, neutrophils, and the bills like the normal serum calcium level, sodium level, potassium are all within the normal range, which indicates a normal result. Next, I'm going to pass it to Yanni to present on medications.
Okay, next, I will explain about the pharmacological management. These are the medications that are prescribed to Madam G. First is tablet simvastatin, which is used to slow down the progress of heart disease and to lower bad cholesterol in the body. These medications cannot be used on pregnant women as the fetus needs cholesterol for development. Second is tablet amlodipine. It is used to treat high blood pressure. Pregnant patients are advised not to breastfeed while taking the medications. Patients also taking tablet bisoprolol, which has the same use as tablet amlodipine. Patients would be advised not to skip the medications to prevent her conditions from worsening and to prevent other serious heart problems. Third is tablet prednisolone that is used to treat allergy signs. You must explain to the patients that long-term of the medication may cause weak bones and increase the chance of getting cataract and glaucoma. Next are tablet calcium carbonate and tablet calcitriol. Both medications are used to treat low levels of calcium in the body. For this medication, patients need to maintain adequate intake of fluid during the treatment. Lastly is tablet pyridostigmine. It is used to treat muscle weakness in people with myasthenia gravis. For this medication, we need to teach patient to not chew or crush the medication, but to swallow it as a whole, and patient can take it with food or milk if it upsets the stomach. Next slide will be explained again by my friend, Jirapon.
Thank you, Yanni. Next, I'm going to present on the nursing care plan formulated specifically for Madam G. Since Madam G is having myasthenia gravis, we have formulated two prioritized nursing care related to her impaired swallowing. The first one will be impaired swallowing related to neuromuscular impairment as evidenced by drooling and difficulty in swallowing. Assessment was done on Madam G at 11th of January at 9 a.m. In the morning, Madam G has verbalized that she can eat everything as long as she can swallow and wait. So we take this as our subjective data. Also, when we observe Madam G, we found that she is having drooling saliva, concomitant with difficulty in swallowing and also stasis of mucus secretions in her oral cavity. Next, our nursing goals is to make sure that the patient will display an improved swallowing as evidenced by able to tolerate fluid through entry feeding, absence of aspirations, reduced stasis of mucus secretions, and drooling throughout the hospitalization. Our nursing interventions that needs to be done on Madam G is first to assess the patient's ability to swallow by letting her to swallow a little sip of water to determine the extent of swallowing mechanisms. Next, observe Madam G for coughing or choking during NG feeding, which may be a sign of aspiration. Next, during the feedings of NG feedings, position the patient in semi-phallus position to promote the airway clearance due to stasis of mucus and also to promote oxygenation via maximum chest expansion. Also, we need to keep Madam G in an upright position for more than 30 minutes after the feedings to prevent aspiration due to backflow of ingested weight. Also, we can also encourage deep breathing and coughing exercise to promote lung expansions, which can facilitate the expectoration of mucus secretions. The last nursing interventions that can be done is to follow the prescribed diet by the dietitians and also doctors, which is 4 scoops of glucosinamide powder with 200 ml of water to be given every 3 hourly to ensure 1,260 kilocalorie and 56 grams of proteins are provided daily through the NG feedings. So our nursing evaluations after 2 days of nursing interventions, which is at the 13th of January, we found that the patient is able to display and improve swallowing as evidenced that she is able to tolerate fluids through NG feedings, as absence of aspiration, reduced stasis of mucus secretions, and also during after days of interventions. Okay, the next nursing care plans will be the risk of aspiration related to difficulty in swallowing. Our assessment is also done on the same day, which Madam G stated that she can eat everything and because she can't swallow any foods. So our objective data is energy display of weakness and fatigue, difficulty in swallowing, and 2 changes in voice. Our nursing goals you has been divided into short term and long term. Our short term goal is to make sure that the patient will not experience aspiration, which is no aspiration throughout the hospitalization. While our long term goal is that patient will eliminate the risk of aspiration during and after the hospitalization. So, our nursing intervention is to assess the patient's ability to swallow and the strength of gait reflex to help us in determining her efficiencies of the productive mechanisms and also her swallowing, whether she's still okay to be continued with the entry feedings. Okay, next is to position the patient in semi-flawless position during feedings to decrease the risk of aspirations by decreasing the reflux of gastric contents. Next, we can educate Madam G and also her family members about the need of proper positioning during NG feeding, which is an upright position which can decrease the risk of aspiration. Next, instruct the patients and also her family members about the signs or symptoms of aspiration. So, whenever the signs appears, her family members can immediately inform the doctors and nurses for medical attention. Last, we can educate the patient on deep breathing and coughing exercise to promote effective breathing and gas exchange through maximum chest expansions. So our nursing evaluation is that the patient is free of aspiration throughout hospitalizations as evidenced by noiseless respirations, clear breath sounds, and clear secretions after 2 days of nursing interventions, which is 13th of January at 11 a.m. Then the patient is no longer at risk of aspiration. So I will pass this part to Yani again to explain on health education.
Thank you, Jirapon. Okay, next I will explain about health education. For health education, during admission, patient complained that she had a lot of secretion, so we can teach her on how to do deep breathing and coughing exercise, which will help her to escape the secretion and at the same time lessen the need to do invasive procedure, such as suctioning. Secondly, since patient is on NG tube, we can teach the relatives on how to give feeding through the NG tube. Moreover, patient and her relatives need to be educated about the use and side effects of her medications to make sure that patient will be compliant to her medication. We also need to encourage relatives to always stay beside patient to prevent any fall incidents. We can also recommend the patient to avoid strenuous activities to prevent patient from being exhausted, which may increase the risk of fall. Lastly, we need to educate Madam G to always follow up care and doctor appointments in the clinic, especially after discharge, to ensure patient is moving forward with their prescribed treatment plans, undergoing testing and her medication. So these are our references. That's all from our book. Thank you.